All right, well, good afternoon, everybody. I think it is 2 p.m. and we appreciate everybody being here for our Supervisor Town Hall meeting. We as a group, as an employee operations group and HR team, we thought it would be important to just continue to stay in touch with employees and our supervisors throughout the semester as we've been going through these unprecedented times. So we really appreciate you taking the time to join us this afternoon. I'd really like to pass along our sincere thank you for all the hard work that you and the entire campus community has been putting in to making this semester successful. Like all of us, I'm sure we have all felt overwhelmed and as we have faced challenges that we have never had to deal with in terms of managing employees or managing certain programs in times like this. Whenever you felt overwhelmed with that, I hope you can also stop and reflect and see that we have students in classes and that we are fulfilling the mission of the university, and we're functioning, we're doing it in ways that we've never had to do it before. But that has really also been rewarding to at times just slow down and see all that we've accomplished over the past several months together. I think that's a great testament to the whole campus community and all we've been able to do. Today, I'd just like to briefly introduce some of our panelists. We've got a team here that hopefully is going to be able to answer questions from this group. First off, we have Joanne Tokel from Academic Affairs that will be here to kind of talk about any questions that may come up from the instruction and academic side of the house. We have Katie Thomas, who's an associate director here in the HR office, who has been instrumental in many of these protocols and our rebound guidelines. We have Chris Boyce from Emergency Management also that has been so great, his leadership in helping us guide us through these interesting times. And Dr. Rex Force, Senior Vice Provost and Vice President for the Division of Health Sciences here on the line as well. So lastly, I'd like to introduce Ginny Larimore from Marketing Communications, who will be serving as our moderator today. And I'd like to maybe pitch it over to you, Ginny, to kind of take it from here.
Excellent. Thank you, Brian. Welcome, everybody. This will operate much like other town halls. You can ask the question publicly in the chat, or you can type directly to me, and it will remain anonymous if you do so. Additionally, we have a number of pre-submitted questions that were submitted after we sent the email with the invitation to this in the previous town hall. So we're going to be going through those first. So if you have a question, feel free to go ahead and submit it in the chat in whichever way you're comfortable. And we'll get to your questions after some pre-submitted questions are answered. And then first, what we're going to do is ask Rex to give us an overview of COVID-19 status, maybe for our region and for Idaho State University, or our region, I should say. Rex?
Good afternoon, everybody, and welcome. I will give a little bit of an update on where we stand on campus and in the region and state. The state is reporting over 40,000 cases of COVID. We actually have seen kind of a double dip phenomena occurring with increasing cases pretty much since the first of the month, potentially associated with Labor Day as well as the return to school, not only university, but obviously K through 12 as well. In Southeast Idaho, we are seeing, I guess, a parallel increase in cases over the last few weeks. And we have seen on our campus an increase in cases. This next reporting period, which will be up on the website shortly, we will have about 40 cases reported. That's up from, I think it was 26 during our last week. Those cases are associated with several different clusters on campus, as well as a lot of COVID occurring from outside activities and students, faculty, and staff that have ended up being positive from those outside activities. The operational levels will be updated, I think, tomorrow, because we had a difficult time getting the administrative council together on Wednesday this week. So we will see that updated tomorrow. The cases that we're having on campus, we have, as I said, several clusters. A cluster we define as more than 2 cases that are somewhat associated. And we do a lot of contact tracing to identify whether those cases are truly associated. That has resulted in the temporary, I guess, quarantining of 3 programs on campus. And we also have some cases in our dorms. We have several of our quarantine rooms being utilized on campus at the present time. I think at last count it was 4 of our 27 quarantine rooms were being used. And these are some of the metrics that we utilize when we create the scorecard each week and provide that to the President's Administrative Council for determination of our operational level status. And I guess with that, if there are any questions, I'm happy to answer those. Otherwise, I can kick it back over to Ginny for beginning the Q&A from the pre-submitted questions.
Thank you, Rex. So 2 follow-up questions to your statement. One is a clarification if we are changing status, and that they weren't sure, it was unclear if we are changing status.
So that will be determined by the Administrative Council. As I said, they're not able to meet today. They're meeting tomorrow. And they are the ones that make that determination. So those are the vice presidents of the university and the president. And so that will be discussed tomorrow as we go through the different metrics that the university looks at each week.
And then to clarify, what is a quarantined program?
So we have programs where there have been multiple cases within a program. So let's say it's a classroom. Let's say it's a program in the College of Technology or in the Division of Health Sciences. In that case, where we have multiple exposures from at least 1 positive case within that program, we will then have that program quarantine those folks that are in close contact, whether it's students, faculty, or staff, for the required period of time based upon CDC recommendations. So in this case, we do have some programs both in the College of Technology and in the rest of the university. And those programs are at present quarantining and have had to move to either fully distance and online instruction, or had to halt instruction for a period of time, or at least adjust their schedule based upon the inability of those folks to get together because they're quarantining, if that makes sense.
Great, thanks, Rex. And then relating to the cases rising, there's a question on why we are planning to hold graduation if cases are rising.
So I think that's a great question. At the present time, we are planning a graduation. That graduation will not have anyone in the audience. The family members and friends will have to watch virtually through the streamed performance. Obviously, there will be substantial public health precautions put in place to have folks space and be spaced during the graduation ceremony if it moves forward. And I guess I say that because obviously the university reserves the right to change their plans based upon the public health needs of the community and the institution. And we will evaluate that right up until the time of the graduation. So your question is a fair one. It's not going to be until late November, and we will be reevaluating the feasibility and the safety of having even a very limited graduation as we move closer to that graduation date. And it is possible. I think anything is possible at this point, but it is possible that graduation would have to be postponed or canceled or revised in some way based upon the public health needs. But at this point, the plan is to move forward with a very, different kind of ceremony.
Great. Thanks, Rex. And I have another COVID student question. So I'm going to pitch this one to you and then to Joanne. So the question is, I have a lot of faculty asking, how do we determine if a student has an actual COVID excuse, either infection or exposure, or if they are using COVID as an excuse to miss class, et cetera? Is there consideration from administration to reach out to faculty? Thank you.
So the way that we do this is we have folks that are exposed to somebody with COVID, someone with a confirmed test, or somebody who's worried about exposure, reach out and use the self-report form that is on the Roaring Back webpage. And I'm going to probably repeat that several times. Use the self-report form. And in that process, the COVID health team will work with students or faculty and staff, depending on who might be affected by the illness, and provide them with guidance and instruction. There are instructions that we provide for students, for example, to answer this question, to communicate with their professors so that we have some understanding of the students' needs, if they need to quarantine or isolate, depending on if they're exposed or actually infected with coronavirus, and then to make arrangements for those students to be able to obviously maintain enrollment and stay within the class. There may be situations where people are being disingenuous or not telling the truth about this. We don't have a formal an automatic, I guess, notification of faculty or other folks that are not part of the actual case investigation and contact tracing process. So, for example, if you're a faculty member and you were in close proximity to that individual who ended up having COVID, you'd be part of the contact tracing process and we'd notify you. And obviously you'd know whether this was real or not. There are situations where we are not going to disclose that information because of both FERPA and HIPAA, patient privacy kinds of things. And so, for example, in this case, if the professor wasn't part of the contact tracing program, we do not automatically reach out to that professor and tell them. We do encourage the students to communicate and contact folks because they need to get accommodations made for staying in class.
Thank you, Rex. For academic affairs side of things, if Joanne or Blake have anything to add to that, I would leave a moment for them.
I don't have anything to add, Jenny. Thank you.
Okay, thanks, Joanne. Okay, so we have a couple of more questions related to COVID and status, but I'm going to jump to the pre-submitted and then come back to these and give Rex a second. Okay, so first question is one of clarification on wearing a mask outside. So the question is, can you please clarify the rules about wearing a mask outside? When do you need to wear one? And for this, I'm going to turn it to Katie.
Yeah, hi, good afternoon, everybody. I can definitely try to clarify that one. So we have taken a very cautious and conservative approach to outdoor face covering usage. And just remembering the whole purpose of wearing a face covering is to prevent aerosol transmissions, right? So to keep it in as much as we can on everybody who's wearing a face covering. So that said, what we're asking is that you wear face coverings outdoors if you're in the proximity of others. So a couple examples to just help you sort of sort through where this is and isn't required. If you're walking across campus with somebody, so on the sidewalk, even though you're 6 feet apart, but you're walking with somebody, you're chatting, we want you to keep your face coverings on, because again, this is preventing those particulates from getting into the air, the aerosols from getting into the air. However, if you're walking across campus and the nearest person you can see is all the way across the quad and there's nobody else on the sidewalk, nobody for miles, you can remove your mask while you're walking or moving around. However, keep it with you in case you may run into somebody. So if you're headed down a sidewalk where, you know, there's nobody near me right now, but I can see in 100 feet or so, I'm going to pass by somebody, we'd like you to keep your mask or face covering on. So I hope that helps sort through a little bit. So when you're isolated, you're by yourself, you're not really in the proximity of people, whether you're walking or biking alone, you can remove it. But if you are in a more crowded or congested area, or area where you will be passing by people, or you're walking with a group, even though you're 6 feet apart, we would like you to keep it on.
Great, thanks, Katie. We have a couple of questions related to ventilation. So I'm going to lump these together and ask you to tell us how ISU is responding to ventilating our buildings in general, and how that process has been working throughout our time in COVID.
Yeah, sure, I can talk about that. So we've received this question a few times, and so I've talked with Cheryl in facilities, and Cheryl, I see you're on the call today, so feel free to jump in and add anything if you have anything to add. But facilities has evaluated all the HVAC systems across campuses, and they've adjusted every HVAC system that is possible to allow as much outdoor air to come inside as possible. So to maximize the number of air changes per hour, all of the systems that are capable of being opened up to the maximum extent possible have been. They're also using filtration where filters are available in those systems. And then this approach, combined with obviously the reduced class numbers, the use of face coverings, the socially distanced classrooms, et cetera, is all intended to minimize that indoor air potential for spread. So that is what they're doing. And again, every building is different. Every building, every campus location has a different system or different layout. So they're all variable or somewhat variable. So if you have a particular question regarding a specific location or building, you can reach out to facilities and ask a more specific question if there's a question or concern. Cheryl, you have anything to add there?
No, that's great. Thank you, Katie.
Yep, thanks.
Okay, Katie, I'm going to lean on you one more time, and then I'll give you a minute. So the question is, if students are currently on campus walking around in groups and not wearing masks, if this happens, what is our way of enforcing?
Yeah, sure. So like any other safety requirement, this is something that we all have to do together. So it's taken us some time. I know this has been a major adjustment, and an adjustment that we've all had to make very quickly. So if you see a group of students walking across campus or in a building and they don't have a face covering on, if you are comfortable doing so, you are welcome to approach them kindly, remind them we have a face covering requirement. In some cases, they may be from off campus and are not aware for some reason, but you can direct them to where they can get them. A lot of entrances, building entrances and exits have them available. So if you're comfortable doing so, you can definitely do that. And that's for employees or students either way. So we're all kind of in this, from a safety reminder standpoint, all in this together. That said, we do have a couple of other groups where if things are repeat situations or escalating behaviors regarding students, potentially in a classroom where it's the same student over and over and over that you're educating and trying to remind and asking, that can be escalated to the Dean of Students office to have a further conversation. Sometimes sending them or referring them to disability services to discuss accommodations. So if somebody indicates that they're medically unable to wear a face covering, we want to be able to work with them, whether it's a student or employee, on appropriate accommodations to handle that situation. And then we've also started a couple of other programs regarding public health ambassadors. So we now have some public health ambassadors that are circulating around areas in the Pocatello campus, specifically to help educate those who are not wearing face coverings or following guidelines, specifically to help educate them on those guidelines, provide face coverings if necessary, etc. And then also rewarding behavior where they're seeing people following the rules well, which is happening in a lot of cases. And then lastly, for employees, we are working with those departments and cases if there are specific concerns regarding individuals, sort of on a one-on-one basis. So if there's a department that you're concerned about, or people that you see not wearing masks consistently, you can always feel free to reach out to the leadership of that area or reach out to HR and discuss your concerns, and we can follow up directly from that standpoint.
Great, thank you, Katie. Brian, I'm going to give this next question to you. There's a question about where the questions come from for our town halls over these last 6 months. The note is that a lot of them seem to be some similar questions, and so origin of questions that we address in these town halls.
Thanks, Ginny. Yeah, we've received many questions over the past few months leading up to the fall semester and since the semester has started. Part of those have been solicited through the announcement of this town hall that we gave people the opportunity to submit questions, over the past week. And many of those questions were pretty similar, and they have come up with a lot of frequently asked questions that have been transferred over to our webpage. So many of these questions and topics that we're addressing today, you'll also find those resources on our COVID-19 webpage with some of the FAQs there, as they're ones that do come up pretty frequently. But we're pleased to be able to have these kind of town halls, and I think we're going to continue to have these kind of venues to reinforce those common questions and hopefully provide all of us the information we need to continue working through the semester.
Great, thank you, Brian. Katie, I'm going to give this next question to you, and it's a little bit long, so bear with me. Will the university please engage in more explicit messaging around mask wearing in university buildings? There are still numerous interpretations floating around out there. For instance, it has been clarified in some supervisor leadership meetings that masks must be worn when in empty hallways, building lobby areas, general department reception rooms, areas, etc. That people still think that as long as you are 6 feet apart, no one is within sight, and that you don't need to wear your mask, then you don't need to wear your mask. A message can actually be simple. It does not have to be convoluted. And it does not help that different offices on campus are practicing different behaviors and advising people, including in different areas offices, incorrectly on this. How can the university do a better job in regards to this?
Okay, that's a good question. And yes, I can definitely help to clarify that. So again, similar to the outdoor approach, we're taking a relatively conservative approach indoors as well. So the language that we have stated is actually fairly direct. I know there are a few nuances, which I can mention just as we talk about this, but the bottom line is face coverings are required inside buildings unless you're alone in a private office, period. There are some questions about different types of workspaces, cubicles, for example, tall cubicle walls, short cubicle walls, spacing, type of task being done. So if you have an area where you're thinking, well, gosh, is this person who's behind a cubicle, but there's tall walls and they're 20, 30, 40 feet away from anyone else? Are they required to wear it when they're sitting at their workspace? For those types of questions, we're encouraging you to engage with the COVID hotline through the ISU Health team or facilities to talk about those more specific circumstances. They advised on a lot of those types of situations this summer. But ultimately, yes, if you're inside a building and are not alone in a private office, you need to have your face covering on. So this includes if you're walking through a hallway, even if there's no one in sight, please have your face covering on.
Can I jump in just for a second on this one?
Please.
So
Yes, please.
there's some great posters that are on our website that you can print out that say, we're wearing masks. This is a mask area. You can post those on the door to your office suites. And so it's obvious. And then the signs that we put up in the corridors too, like remain 6 feet away and wear your mask and all those, the 6 points that we're following. Those posters I think are really good to kind of, it's something in writing and it has a nice graphic and it just makes it easy to say, here's this sign.
Thank you, Cheryl. And I just posted, it's available on the Roaring Back site, and then it's also on the brand site that I just posted. So Katie, we have a follow-up question about what you just explained, and they want to know if this applies in dorms as well.
I don't know the details on housing and how that is different or the same. Rex or Cheryl, do you know any details regarding housing? I'm pretty sure based on conversations we had this summer, it was very, very similar. Kind of wear your face covering, maintain physical distance unless you're in your own private room. Is that correct?
That's right. My recollection, I don't have the policy pulled up right here in front of me, Katie, is exactly that. When students are in their private room, with their roommate. That's kind of like being with their family. That's okay. Once they step outside into a more public space in the hallway, they should be wearing a face covering.
Great, thank you. The next question I'm going to ask Rex to answer, and it's, how should I respond to an employee who feels they have symptoms or thinks they have been exposed?
Well, first of all, if that employee is at work, they should go home immediately. If they're at home calling in, and it could be a student calling a professor in a class as well, they should not come in. And in either event, they should contact the COVID hotline or fill out a self-report form right away. Preferably, they would do the self-report form. And really, the self-report form is for anyone who is tested positive, who's awaiting a test, has had close contact with a positive, any of those issues. If they have symptoms or not, even with those exposures, those folks should not be coming to work or coming to school. And so they fill out that form. The self-report form is then fed to our COVID case report and contact tracing team. Those folks will then reach out to the individuals that are affected and be able to ask a few questions, provide some education and guidance, and then provide the recommendations for them moving forward. So first things first, we get that form filled out. We get ill people off campus if they're on campus. Don't tell them they need to be on campus if they're not already. And we also have a trifold sort of instruction sheet that has a lot of guidance for folks if they've been exposed, if they've tested positive, if they have symptoms, if they're worried, and how they should be interacting with their supervisors or instructors, and vice versa, how instructors and supervisors and professors should be interacting with those individuals. And I think, Ginny just posted it in the chat, the link to that trifold. Thanks for doing that, Ginny. And it's very, very helpful. I think it walks through most of those situations.
Great, thanks, Rex. We have a number of questions that I'm going to be sending your way about specific situations. So this next one, what should students, faculty, staff do if someone is symptomatic but refuses to get tested?
So I think that becomes either a dean of students or an HR related issue, depending upon what type of person it is. Are they a student or are they an employee? We do feel that there are a very, very small minority of people who might resist getting tested, might resist going home, might come back too soon, and against recommendations. And in those settings, you're more than welcome to reach out to the COVID Health Committee. We will then work with supervisors and student affairs, depending on the type of person that we're dealing with, to then be able to come up with a solution in those settings.
Great, thanks, Rex. Another one for you. I'm finding personal travel has been extremely difficult to navigate, especially when staff are not taking precautions. However, their job can't really be done from home, so they refuse to take additional time off to self-isolate upon return from travel to high-risk areas. What do we do as supervisors to navigate this?
So again, I think it's reasonable to reach out to the COVID health team for some guidance and some support. Obviously we can work with, leadership to be able to come up with recommendations if folks are not sort of doing the right thing, doing the recommended thing. Right now, we know that the vast majority of cases that are occurring on campus are travel related. They're families getting together. They're people going to restaurants and bars and doing things that are considered in this day and age, unfortunately, high risk for contracting COVID. People need to use the same precautions that we're talking about doing here on campus in their lives 24/7. If you're out in public, if you're interacting with others, even family members, even friends, it's very important that we can continue to do a disciplined approach at disease mitigation. That is wearing face coverings and trying to maintain distancing. It's very easy to trust family and friends, right? That's natural. The reality is that's where the bulk of spread occurs. And so even though we trust them and we have sort of social norms that we're adhering to, and it's rude to put on a mask when your good friend walks up, we have to be doing some of that in this setting, or the disease will continue to spread. So we have to reinforce that we do the right things, and that even when we're doing personal travel, we maintain that. And the reality is people need to adhere to those the guidance that we've provided related to personal travel. Otherwise, we're going to see more spread on campus. The vast majority of spread on campus has been associated with outside activities and travel.
And then Brian, I don't know if there's anything else you would like to add to this question.
Yeah, thank you, Jeannie. I just added a link in the chat that I know the public health team, in cooperation with the employee operations team, put together kind of a flow chart to help employees and supervisors kind of navigate some questions about when does maybe a self-isolation period need to occur after some travel. So take a look at that, and we hope that helps provide some of that guidance. But if there's anything that I think we all come away from this meeting as supervisors today, I hope you all can remember the great resource we have on team with our COVID hotline. That team is so helpful. I mean, we have some of the greatest public health experts in the state here working with us. So when you have all those real unique situations, this group can help consult with you on the right answer, because unfortunately this is a complex situation with so many variables that there's not ever a real simple one answer to fit all. So the COVID-19 team is so great to help engage with you and talk through the specifics of those circumstances and the travel, and we can engage with you as well to help find the right solution and keep us all as safe as possible.
Great. Thank you, Rex and Brian. And then Brian, while I have you, if there's anything else you would like to add, how can a supervisor support an employee who has symptoms or has potentially been exposed? How can supervisors support them? Yeah,
I think this can touch on a little bit of what Rex was talking about as well. And I continue to get a pretty frequent question, nearly daily question from some supervisors and department heads. And I completely understand this question because we all have this fatigue now too, is when are we going to go back to normal? When are we back to just being on campus and doing the jobs we've always been doing? And I ask myself those questions all the time as well. But the honest answer is right now, we don't know. We don't have a time frame on going back. So what we're all needing to embrace now is our new normal, and these are our circumstances for the foreseeable future. And one piece of our new normal that is going to be with us on an ongoing basis that I think we're going to need to continue to embrace and even enhance is work from home wherever possible. We can also discuss leave of absence options as needed, because we completely understand that not every job is conducive to working from home. And that's, again, one of those things that I wish there was always the great perfect answer for every single solution, but there's not. But telework wherever it is feasible is something that we need to continue to not just approve when it's requested, but as supervisors, we're all going to still need to actually actively identify where can I assign more telework? Where can I have more people working remotely wherever possible? And as supervisors also, the thing that I'd encourage is you don't have to have all those answers yourself. I think you can engage with your management teams, your leadership teams, engage with the employees that your work teams too, to kind of brainstorm and think what can we do more of at home. Many units, including HR and others, have needed to adopt kind of a rotating staffing schedule that we have an ongoing kind of on-campus presence that we need to continue to have to some degree. but yet we don't have to have everybody congested together in the office every day either. So, if you can think through those things and actively assign telework wherever it makes sense, that's going to help support employees who are dealing with things that they have never dealt with before either. And that reduced congestion on campus can be very, very effective in terms of reducing risk and possible exposure, where we can have more physical distancing and less people bumping into one another.
Great. Thanks, Brian. I'm going to get to a couple of our live questions since I want to make sure that we hit all of them. So one question is, this might be a good one for Cheryl. We have a multi-purpose room that serves as both classroom and lab. We asked for fogging on a more regular basis because they are being used. How do we get our PT/OT rooms in Garrison on the schedule?
Thank you for asking that, because we just submit a request on our website, but I'm just going to write it down right now. All of the classrooms should be being fogged every 72 hours or less with a chemical that remains on surfaces to kill germs for that amount of time. So I'll follow up with that.
Great, thanks, Cheryl. Okay, back to the question about students and dealing with absences. So this might be a good question for Joanne. If a student is able to provide documentation to their professor about an absence due to COVID-19, are professors then required to provide the student a chance to make up any missed work?
Well, it was our hope that faculty would be understanding of students in these situations, because the last thing we want people to do is to try to come into campus, submit work or whatever if they are ill. We don't have a hard and fast rule on that, but that certainly was our intention, that faculty would have some understanding of students in that situation.
I'm going to give you a little story about that. We had a student recently that became ill with COVID. That student was extremely stressed, extremely worried about being able to make up their work. It also happened that that student had lost 4 family members across the country to COVID. This is, for some individuals, an extremely traumatic, difficult time. And it is, I think, an expectation that we're going to be as compassionate and supportive of these situations. And I get it. There are occasional, rare situations where people are taking advantage. But for the most part, this is the real deal. And people have been affected on campus dramatically. That individual student had to withdraw. They simply could not continue this semester. And we absolutely want to keep students engaged in their program and their course of study and be able to continue at Idaho State University. So I really do think that we are obligated to do the best we can to keep people going through the semester.
Thanks, Rex. And while I have you, this is some feedback / question. This is in regard to our current status at the university and our COVID situation. We have been told that the university will communicate if we change status, why that change was made. Faculty have asked also for weeks that we are not changing status, but there's an explanation for why there's no change.
So we can talk with our marketing and communications folks. You know, the individual metrics that are utilized each week change individually each week. And so when we look at the individual metrics individually as well as collectively, it's a rather complicated equation to determine whether we're going to change overall operational status. So if we're looking, say, at 4 levels within 15 different metrics, right? Because we have a green, yellow, orange, and red in essence, for every metric we're looking at. It's complicated. And so one week we might have a few more yellows than we do greens, and the next week we've got a couple of oranges but more greens, and it's there's a little bit of subjectivity that goes into interpreting those. Now I will say that some probably hold more weight than others, right? Just the flat out number of cases on campus and how many we're dealing with, and whether that's exceeding our quarantine capacity and how it's affecting our ability to deliver instruction, that's a big one. But I can also tell you that week to week, we get shifts between these different categories. And so providing the campus with all of that information is a difficult thing to, frankly, to manage. I'll be perfectly honest with you. And so we've talked a lot about what metrics are included, and we provided some metrics on the website. But the secret sauce, I guess, that goes on behind the scenes to pull all this together it's really not that secret, but it is complicated to be able to pull that together. And we have not reached the point that we've moved out of the yellow category. I will tell you that I'm not certain that we're going to remain there indefinitely, but I'm hopeful that we can, and I'm very hopeful, as Brian talked about, that we can make it through the rest of the semester. But there may be metrics that change, that necessitate a change, and we'll obviously notify campus as soon as we can. And to be perfectly honest, I'd like to see us notifying campus in advance of that change if we think that we're trending in that direction. And so far, we have been relatively stable. I will say over the last couple of weeks, there's been an uptick in cases that we're dealing with.
Thanks, Rex. Let me jump back to Joanne for a second. So this is to piggyback on the question about supporting students. Should they be affected by COVID? So the question is, what steps do we take if we identify a professor who is unwilling to work with a student who has a documentation for COVID?
That's a good question. I would think that you would go first to the faculty member's immediate supervisor, the chair, and reach out to that person. If you feel like you're not getting a satisfactory response, take it up to the next level, the dean, or whatever.
Okay, thanks, Joanne. Next question, I think this is going to be for Rex and or Katie. So to be clear on what I'm hearing, we are a mask-wearing campus, but we'll make accommodations for students who can't wear a mask. But what if that student comes to the service provider area, say tutoring for assistance, and either the service provider or other students are wearing masks and notice the student is not? Services shouldn't be denied to that non-mask-wearing student, or should it? How and what is the best procedure to handle something like this and not violate ADA or HEPA?
So I am going to let Katie chime in on this, because we worked hard, and Katie worked harder than the rest of us on trying to craft mask policies. But I will say that there is an expectation that, frankly, everybody be able to wear some sort of face covering. Katie, do you want to talk about the specifics and how we determine that?
Yeah, for sure. And one thing I want to clarify before I even get into types of face coverings is that sometimes accommodation doesn't mean fine, you don't have to wear a face covering. I don't know that we have any circumstances where the accommodation is you don't have to wear a face covering. In most cases, and I think in more employee cases probably than student cases, I don't know the details of student accommodations, but in many cases, the accommodation is that student moves online, or that employee works remotely, or they work at a time when others are not present, or they work in an alternate work location where they're isolated from others. So the accommodation of somebody who's medically unable to wear a face covering does not necessarily mean they can show up without a face covering and say, I'm not able to wear it. Now, there have been certain situations where we have referred students, especially to disability services, to discuss accommodations. And in some very limited cases, the accommodation is use of a face shield. So at minimum, those individuals that have an accommodation and are potentially seeking in-person services for whatever reason may be wearing a face shield. I think that combined with, and Rex, I'll kick back to you to talk any sort of logistics of meeting with somebody in that case. But if they show up with a face shield and they can go, if somebody shows up with nothing and says they're medically unable, send them over to disability services and disability services will hand them one. There's no formal process. It's not complicated. We want everybody to have something. So if they show up without anything, you can send them over to disability services, refer them there to get a face shield. The other thing that some of them have, and this is more for the accommodation needed for people who need visibility of mouth for hard of hearing or deaf individuals, is a clear mask or a window mask. So some are unable to wear a full cloth face covering, but they have some other styles over at disability services that some individuals are able to wear. So it depends on what the accommodation is, but the accommodation is not typically, you don't have to wear anything. So if they show up without a face shield, send them to disability services. If they show up with a face shield, you can take additional precautions of making sure you're separated by 10 feet. If you have a plexiglass barrier where you can, so in addition to them using a face shield, you can step around a plexiglass barrier or some other situation like that. Those are definitely accommodations or necessary possibilities of things that you can do from a physical standpoint, just anything you can do to increase your distance. The other option is if they show up and they don't have any sort of face covering, aren't able to wear one even temporarily, you can offer to do a service appointment remotely. So you can go in 2 different rooms and offer to do a Zoom-based service appointment as well, if that's a possibility. So Rex, any other thoughts on sort of logistics there?
No, I think you hit it great. You came up with lots of good solutions. I would just state that face shield is likely not as effective as a face covering. That's why it's an alternative. That's why we've used it in these special circumstances. And I would suggest that if you're sitting down with someone with the face shield, you try to maintain more than a 6-foot distance if possible. And if that's not possible, I think having the remote conversation like Katie just outlined makes a ton of sense.
Okay, and a follow-up question. What if I have a staff person who says they can't wear a mask and I've just told them to work remotely? Is that okay, or should they all report to Karina?
Brian,
Brian, do you want to answer
Katie
that one?
or Brian?
Yeah, if they can work remotely, that is again something that we as supervisors can is a very important part of our operational plans. It needs to be that remote work. So if that's a reasonable solution, then that's excellent. Now, if their job requires some on-campus functions to be completed, then yes, we can absolutely engage with disability services as well to see what type of accommodations may be feasible. Again, we have not had any accommodation situation now that says, okay, you're exempt from the need to have any protective equipment. But we can have an interactive process and a dialogue and find the right solution. But likely telework is going to be something we have to strongly consider in that situation to have them perform their work in a safe environment for themselves and for their coworkers.
Great, thanks, Brian. Next question, back to our pre-submitted questions. How should we handle student workers who want to work from home? And I'm going to give that one to you, Brian, as well.
Yeah, so that's also been a fairly common question that with the assumption that maybe telework is only available to our benefited employees, to our ongoing faculty and staff. And historically, telework for a student worker would have been something that was incredibly rare. But it's not rare anymore. That again needs to be a common part of our toolbox. So if you have a student employee I have two in HR that are some CPI students that are helping us write, policies, job descriptions, training plans, things like that. That doesn't work, of course, for every position. But if you have a student employee whose duties can be done remotely, you have that delegated authority to get the work done in a manner that's most safe for that worker and coworkers.
Great, thanks, Brian. Next question, also for you. How can we keep personal health information private while still trying to appropriately report COVID-19 related information?
That's a very good question, and something that has with all of the excitement of the fact that we as supervisors need to do everything we can to protect those employees who have self-identified as being in a vulnerable population. We equally have the same responsibility to protect all of our employees' right to privacy. And there's numerous regulations with the FMLA, with the ADA, with Genetic Information Discrimination Acts, the Age Discrimination in Employment Act. So that there are a lot of regulations out there that we cannot widely broadcast to say this person's home because they're infected, or this person's home because they're of a vulnerable population. So if I can give strong kudos again and highly recommend the COVID-19 team, engage with them. They are so good to work with. And you don't have to worry as supervisors to start, like, who do I notify if somebody's ill? You don't have to go about that alone. Engage with the COVID-19 team. They will initiate all the contact tracing protocols to notify those individuals that need to be notified for health specific reasons. And they will help guide you on what type of information needs to be disseminated. And we can help you with on some of those things as well. But by all means, the COVID-19 team is, you can call in the pros here, and they will help you go through the contact tracing protocols. They'll take that all off your shoulders and get the proper notifications out, while safeguarding, of course, the confidentiality of the employees.
Great, thanks, Brian. A question for you. How are we supposed to evaluate staff and faculty performance for this evaluation cycle? For some people, they have been really strongly affected by COVID, as in sick with it and stress. It has affected their work performance. Does this get taken into account, or is that unfair because we are in a pandemic? What do supervisors do?
Great question. And first off, I'd also like to say we are going to be preparing some information to go out to campus about the upcoming evaluation cycle, which I can't believe is already rolling around again. Didn't we just finish that? But anyway, we will have some guidance out to everybody soon. And absolutely, we are, as supervisors, are going to have to take into close consideration what are reasonable performance expectations in this type of situation on all sides of the fence, because clearly we have some employees who their objectives, their goals, their projects they were working on were either completely abandoned or deferred. And obviously we can't and should not penalize an employee for these kind of circumstances that were out of our control. On the flip side, I think we all can tell some very heroic stories of faculty and staff across campus who have accomplished things that we wouldn't have ever even been dreaming of a year ago, of things that we have accomplished that weren't on our radar before. So by all means, we should take into consideration the circumstances of COVID-19 and working from home and being shut down for a while. I know academic affairs may be able to give a lot of helpful guidance regarding faculty, because I have heard from some deans and department chairs about how this has impacted the scholarly activity or the publications or presentations at conferences and events that were completely abandoned and canceled. So yes, we're going to have to adjust what our expectations are in terms of productivity. Also, because of something else to keep in mind, we've had furloughs. Employees have had to be furloughed for periods of days. And for some, they were furloughed for a more significant period of time, which clearly impacts productivity as well. So we will have some more guidance to come out with the upcoming evaluation cycle, but definitely COVID-19 should be taken into consideration when recalibrating what our expectations are.
Great, thanks, Brian. This last pre-submitted question is going to fall on your plate as well. So the question is, after Thanksgiving, when faculty and students go online, how do we address whether our staff should work in person on campus or work remotely during that time?
Well, I'd say don't feel like you have to make that decision alone. Engage with your leadership teams, including your dean, your vice president, with your maybe management team around you as well. And I think part of that is really carefully considering what has to be done here on campus. What functions just have to be done here, but yet what can be done remotely. And the more work we can assign on a remote basis now, and maybe that even increases more after the Thanksgiving Day break, and we can have more staff, more faculty performing their work over the last month of the calendar year from home. That will be that'll be great in terms of reducing the congestion on campus, helping reduce that spread here to the best extent we can, and then maybe we can prepare and plan for what we have to put into place for January. But engage with your teams, and by all means, with that change in the schedule this year, let's all consider what work can be done remotely over the first few weeks in December.
Thanks, Brian. And we've reached the end of our questions. So if you don't mind, I'm going to give it back to you for any final thoughts.
Well, I again want to thank everyone for joining us today. This has been such a monumental semester, one that we will, I'm sure, never forget, and hopefully not have to go through exactly the same way again. And if any of you are kind of, one of the main reasons we wanted to get together with this group as supervisors is we just know the important role that all of you have in leading your teams. And I know I felt it too, that we have all felt this fatigue of, are we going to make it? Can we get through this semester? And I think if we keep doing what we have been doing, we've got so much information out there in terms of the protocols and frequently asked questions, that there is so much guidance out there. It can be a little overwhelming as well, but please reach out and get the help from HR, get the help from the COVID-19 team. And if we keep doing what we've been doing over these first several weeks, we can make it over the next 8 weeks. We can get through this. We're kind of at the middle point of the marathon now. But if we keep it up, we can reach the finish line here. And one thing that's going to be so important for us as supervisors is, I know our employees are looking to all of us. And if we can model that behavior. So if, I caught myself over the past week, walking into the file room to just get something quickly off the printer, and I didn't have a mask on, and I had to hurry and stop myself at the door, and I forgot to get that face covering on. But if we can all model that behavior so that our employees look to us, and that they don't become to be a little lax in terms of adhering to the guidelines. If we can reinforce that we can do this, we can keep adhering to all the guidance out there, and by doing that, we'll get through the end of the semester, have that much needed break, and look forward to the spring semester when we get to start over a bit. But thank you again, all of you, for taking the time to be here. If you have questions that we can help with you offline, please get in touch. But that, I think, wraps up all of our time today. Have a great rest of your Bengal Wednesday, and we look forward to talking again soon. Bye, everybody.
Thanks, Brian.